7:16, as adults, we keep track of a lot of numbers. Phone numbers, account numbers, the list goes on. But 3 numbers doctors say you should always have in your possession. You should add to that list. Here with more on that is Dr. Pramilla Subramaniam with People's Health. Good morning. Hope it didn't drive your blood pressure up to come this morning.
Not at all.
Let's not throw a bunch of numbers at people right away. So tell me what the blood pressure should be for us.
Well, the blood pressure is one of the risk factors for having heart disease, and the normal blood pressure should be 120/80. You want to aim towards that. It's sometimes very difficult to do that. So you want to try to get the blood pressure at least less than 140 or less than 135 for the top number and less than 90 for the bottom number.
Okay, so a minute ago I said I knew my blood pressure number because I gave blood recently. I don't have a clue what the blood sugar was or the cholesterol, and your question was?
Why not?
Why not?
Why not?
She actually chewed me out a little bit. But, so, I mean, why is that? You know, my doctor said it was okay. What's the...
Well, it's very important because what is okay for one person may not be okay for another person, okay? So what is important is you need to know what your risk factor is for having heart disease. One is blood pressure, one is diabetes, one is cholesterol, with other things like smoking and family history.
Okay, blood sugar and cholesterol.
And cholesterol.
So what should they be?
The cholesterol, there are 4 different numbers to the cholesterol. One is the total cholesterol should be less than 200. The bad cholesterol, which is the LDL cholesterol, should be less than 100. But if you have heart disease, it should be less than 70. So you need to drive it down to that level. The good cholesterol could be as high as you possibly need to be, but at least greater than 40 or 50. And then you have triglycerides, which are also important, and it should be less than 150.
But gee, doctor, I feel fine, so I don't really need to know those numbers.
No, you do. You do, because it's amazing that patients are on medications, and there is a multitude of doctors that take care of this one patient. There's a cardiologist, there's an internist. Majority of the time, the blood tests are done by the internist. The patient comes to the cardiologist. We don't have the blood test. So the patient becomes the informant for us.
Do you have symptoms? Can you tell when your blood pressure goes up?
Very rarely. If the blood pressure is extremely high, you might get a headache, but you'll never know. And important is, if you know your numbers, then you can convey that information to your doctor, who is also seeing you, and say, are we at go? That's what you need to know.
I mean, if you had a parent who died in their 70s, if you have a sibling with a heart condition or diabetes, does that drive up the importance of knowing these things?
Absolutely. If you have parents, uncles, aunts that have had disease and heart disease at age 50s, 60s, it's important that you need to know what your numbers are.
All right, Dr. Pramilla Subramaniam from People's Health. Thanks so much for that.
Thank you so much.